Okay, hi everybody. So today we're going to consider remedies for problems of the self.
Thank you, Liz.
And the means to this is going to be imaginative, that is to say, to rely on visual imagination for its metaphor, and if ever I say anything like, what do you see, what does this look like to you, what color is it, stuff like that, and you don't happen to be a person who instantly visualizes, as I do, translate for yourself into language of sensation, sort of the energetic, kinesthetic, how it feels in my body feeling, or an emotional language reflecting love, anger, discontent, hope, and the other named and unnamed emotions. So that, and of course, I know you do this with your patients and clients routinely, to speak with them in their experiential language as soon as you can figure out what that might be. On the matter of that language, rather than trying to typecast a person as an X type, a Y type, or a Z type, I think the simplest thing is to take the person's verbal expression and just use that. Neither you nor the person needs to know exactly all the meanings or associations of that phrase that's at least individual to, if not unique to, the person you're seeing. And another thing I want to say about this notion is to relate it to trance. Simply put, trance where you place your attention. So the therapeutic trance, typically I will look directly at you, unless I'm a Sullivanian, in which case, if Barbara's my client, I'll sit like this at right angles. If I'm a Freudian, and Connors is my client or patient, he will have his head next to me, his feet stretched out on the couch, and I, the Freudian, will be looking at my collection of antiquities and daydreaming about my vacation. Bad joke at the expense of good psychoanalysts. So, the focusing of attention, natural in conversation, induces a kind of specialized, different state. Most people are not used to being paid thorough, kind attention. And so you can make a living as a therapist being normally attentive, kind, and listening. In the hypnotic variants of attentiveness that you're familiar with, there will also be the varieties of dissociated attention. This kind of arm levitation thing, or love anesthetic, or various kinds of therapeutic dialogues where you are speaking to aspects of yourself, all this thing that people call parts work. I don't call it that. But anyway, where you have a gestalt-like conversation between yourself and some aspect of yourself, as though you were dissociated from yourself. Same thing you do when you criticize yourself or forgive yourself or have all these other reflexive gestures toward the self that are so difficult and I think pretty unsatisfactory therapeutically. So there's that concentrated attention, dissociated attention. There's a third kind, and the kind we're going to demonstrate in practice today, unconscious trance, attention to and awareness of the unconscious mind. For my purposes, hence at least briefly for yours, the unconscious mind consists of three kinds of processes. It's not, for these purposes, a repository of ideas or objects or memories, so much as it is a resource in the Erickson sense for three kinds of processes that are very difficult to approach consciously. One of those would be the entire neurophysiology of the body. A surgeon with a broken leg is at a loss, though he knows anatomy cold and could fix the leg if it were someone else's. But all that knowledge does not provide sufficient communication, for him to staunch the bleeding the way you can do hypnotically. So it's not a matter of conscious knowledge, but rather of some communication with unconscious management or ordering of the body. The thing we do when we pull ourselves together is an unconscious thing. Or when, as I say, you reduce or increase blood flow in the body without knowing how you do it. Even if you know the body, you don't know how to do that interiorly. So, neurophysiology of the body and its management and change, respiration, circulation, the immune system, digestion, elimination, the senses, vision, smell, taste, touch, reproduction, and the various cyclical aspects of human physiology are all unconscious and under the terms of the act, the way I think of it. The second big area of unconsciousness is ways of learning, not what you have learned. So your declarative memory is conscious. If you ask me, how many pets do we have at home? I answer 3. That's conscious. But if you ask me, how did I learn to love our dog? That's a harder question. I can tell you a narrative. I can give you a descriptive term. But I betcha, as articulate as I fancy myself to be, I cannot give a convincing explanation. And love is a very good example of this kind of thing for another reason I'm about to say, but love is a good example where if you ask someone, why do you love X, but you like and love but aren't crazy about Y, that's where people write series of novels. You will not get a succinct, convincing explanation. So ways of learning, and Erickson always traffics in the way you learn to stand up, the way you learn to write, the way you learned many other things, which you learned at such a young age that there can be no consciousness, as far as we know, in the adult sense of learning. Best example, learning your native language, which you learn, or learning to smile, which you learn before you have conceptual abilities that would allow you to learn it consciously. So ways of learning, very important. And the third element of unconsciousness, as I have it, interpersonal emotions among more than 2 people. I can describe my feelings toward my wife. I love my wife, I fuss with her about this, we're happy about that, and so on. If I add in a third or fourth or fifth person, and my example from my childhood, my mother, my father, my sister, my grandmother, and me, how did I feel about my grandmother's feeling about my father's brother? It gets very complicated. So in my terms, if you can't express it easily in language, ordinary language, if you need exotic terms, special vocabularies, terms of art, we can pretty much consider it unconscious, and particularly for therapeutic purposes, where people have the conviction that if they talk long enough about their relationships, they will understand them.